today on psychological health and safety management. My name is Sandra Serace. I am the Principal Consultant of Leadership and Behavioural Organisational Behaviour at Fusion Safety Management. I'm very passionate about psychological health and safety, as I know you are here today as well. My background is in education, positive psychology and counselling, and I bring that to my teams as I work in the Hero Code Academy. And today with us, we have a wonderful array of expertise here in the room, which I'd love to introduce you to. A recent Gallup insight has told us that psychological injury and psychosocial injury costs the Australian economy $39.9 billion per annum. And that loss of productivity with mental health claims is 4 times that of any other injury and disease combined. So this is a discussion that we really need to tap into. So let me introduce you to our panel. First, we have Lana Rubinstein. Lana is the Managing Director of Risk Strategies. Risk Strategies is a management consultancy in risk, and she looks to prevent psychological and physical injury across all sectors and manages claims, injury and return to work. Tell us a little bit more about what you do.
Thanks, Sandra. So yes, Lana is my name. I own and manage a company called Risk Strategies. We've got a few of our clients here, so welcome. We specialise in all things workplace risk, including safety, quality, environmental management systems. Our strength is in building and developing systems, and one of those aspects of hazard management that we tackle obviously is psychological safety. We've had quite a few programs that we've implemented over the past sort of 24 months in that space, and so we felt it was very important to share our learnings and practical application of the things that we've done and what's worked and what maybe could have been improved on.
Thanks, Lana. Next we have Dr Tessa Bailey. Dr Tessa is the Director of Opus Centre for Psychosocial Risk. There she works with her team across organisations to create systems that prevent psychological risk and psychosocial risk and improve safety, well-being and productivity outcomes. Thanks, Tessa. Tell us a little bit more.
Hi. So yes, Dr Tessa Bailey, but please call me Tessa. I have a background where I did a Bachelor, Honours and Masters in Organisational Psychology. Went out into the world of work looking for good practice, both public and private sector. Found some good practice in early intervention, found some good practice in injury management that was getting better as well. But it was in the prevention side that I couldn't find really good methods or tools. So where the occupational therapist would have some form of assessment for the work environment, I couldn't find an equivalent. So I went back to university to do my PhD with Professor Maureen Dollard at UniSA Centre for Workplace Excellence. We looked at the variety of workplace factors that predict worker health, and what we found, not surprisingly, productivity outcomes as well. In time, our industry partners wanted to just do the applied practice rather than go through the research steps. So due to industry demand, we started the Opus Centre. Now we work with industry on applying that best practice psychosocial risk management. And as long as we follow the method that we found works, we tend to get good outcomes for both worker health and organisational productivity.
Thanks, Tessa. And we have Ross Guastalegname. Ross is the Director of Operations Australasia for Intertech SAI Global. He has 2 decades plus in risk strategy management and safety auditing. Tell us a little bit more about that.
So SAI Global provides certification in a range of standards, from information security to safety, medical device, environment, quality. I've been an auditor for about 17 years, and I've seen the evolution of the standards from a basic hazard control to understanding what's happening around you, inputs, participation of employees. So I've seen that growth, and also in the industry. So where we were once focused on physical injury hazards, and since COVID, where it's moved across to understanding why injuries and accidents happen, what's their behavioural and also people's well-being at work and how that influences the workplace.
We have a wonderful panel here of expertise and insights, but I also know that we have a lot of expertise in the room here today. We acknowledge that people have come here and when they signed up, they are either at the beginning stages or they're at a more mature level. So we really encourage you to speak up, ask your questions, comment, add to the discussion, because we can learn together collaboratively. So before we tap into this knowledge, I'd like to start with a desired state question. So in a desired state, thinking forward, if we had all things in place and we had a psychologically healthy, safe work environment, what would that look like? What would it feel like? What would you feel like walking into that space? So over to you.
You'd be very excited about going to work on a Sunday night.
Absolutely. What else? Excited about going to work on a Sunday night. No more Sunday blues. What else would it feel like?
It would feel exciting and safe, and a place that you could really shine and show who you are and be yourself in that working place.
Shine and show who you are.
Yeah, I'd probably echo that. It's a place where you'd want to go. You'd be intrinsically motivated to turn up rather than being extrinsically motivated to be there because you have to. You want to be there.
That intrinsically motivated.
It's a space where people feel safe to raise questions, to put forward ideas and collaborate, which therefore grows innovation and great teamwork.
So we feel safe to use our voice.
It would be diverse and welcoming.
Diverse and welcoming. Nod your head if you think that sounds like a great place to work. Yeah, I want to go there too. It's great that you're here today, because what we're going to try to do is help you find those steps. So I think one of the first steps we need to think about is creating those frameworks and identifying the risks, identifying the hazards and assessing those risks. So I'm going to lean into the panel here for their expert knowledge. So Lana, thinking about regulations and obligations, can you tell us a little bit more about what we need to keep in mind when we're thinking about frameworks?
Yep. So as most of people in this room obviously know, psychological health and safety has been brought into the legislative framework, somewhat differently in different states. So in the harmonised states, it's been added to the general regulations, specifically highlighted, but added to the existing regs. In Victoria, even though we were the first cab off the rank, we are yet to formally legislate this as a part of a separate regulation or existing regulations. But our current legislation, the Act and the regs, do insist on organisations and businesses managing all hazards. Clearly, if psychological safety is a hazard that is identified through hazard identification programs, clearly you would have to manage it. So I think a lot of work actually goes into how do we identify it properly and meaningfully, and not just do a tick and box exercise to say we've done it and we've got a wellness program to address it, which may well be the case to go, but how do we do it effectively and efficiently? And also, how do we build a program that means that we don't just put a Band-Aid on something today? How do we do it 3 years from now and 5 years from now? How do we not let it slip? So I guess that's the background.
And I think that strategically identifying those hazards and assessing the risks. So I'd like to ask Dr Tessa around that. So how do we strategically look into these spaces of assessment?
It's following that best practice, and it is quite similar in that approach to physical safety. It's now applying it to the psychological and social aspects in the workplace. So you want to identify the psychological or social aspects within a work environment. So that could be across the organisation, or it could be a bit different for certain groups. You want to assign a level of risk because you want to know where the priorities should be. You want to design controls based on that risk profile, and then you want to evaluate to see if that works. So beyond the regulations, which I think they've come due to the understanding and the need, we've seen work change and shift towards being quite cognitively and emotionally demanding. And we've also learnt through research and practice that there are practical reasonable controls that you can put in place to reduce the likelihood of hazards occurring and to minimise that harm. So when you get those systems in place and your people within the organisation are clear about those systems, you can effectively reduce risk, which brings individual benefits, benefits to the team, benefits to innovation, benefits to productivity, as well as prevent injury.
Ross, how would the standards sort of support all of that, creating that framework and identifying those risks?
So from a management systems point of view, it's not enough just to know that there's a piece of legislation. You need to know exactly what your obligation is. And then you also need to incorporate that in your processes. And then you have to do what we call an evaluation of compliance. You need to verify that you're meeting or not meeting that requirement. That then should filter into your management review with top management, and then filter into your risks, your objectives and targets to achieve compliance. And what we also strive for is going to best practice, codes and standards.
And best practice being a really important piece of the puzzle here. So when we're moving into that and we're thinking about what's called corrective measures, which sounds like we're trying to tell someone off, and realistically we're trying to create a system and a design of work that helps us feel safe, and we want to go there, and we feel enlightened on a Sunday afternoon, and we feel that we want to be part of that team intrinsically. So when we're thinking about that, I'd like to start with you, Tessa. What are some of the works that in the organisations that you're working with that are adding corrective measures, and what does that look like?
Well, the good news is that the process is consistent across industry. Again, identify the factors, assign a level of risk, design controls. But also you need to acknowledge that there will be differences within the different groups within an organisation. So it's good to have a look at, well, what policy, practice, procedures do you have? If you've identified certain hazards, well, what is the policy around that? Everything from recruitment through induction, regular training. What's the role and responsibility of HR, workforce health and safety, in managing those systems? What about the leaders? Do they understand their role? Do they understand what's their responsibility and what's not their responsibility? And then we want to look at job design. How do those factors influence designing the job around those particular hazards, whether it's client or customer aggression or whether it's fatigue? And then you can require that the individual participates in those systems, which is their responsibility, so that they can minimise the likelihood of exposure and reduce that potential for harm.
It's not as easy as a one-size-fits-all approach at all.
No, with the transport industry, for them it might be about having clarity in induction about how work pressure gets managed. It might also be letting them know what to expect if they interact with the public. It might be having appropriate debrief if they're exposed to trauma. With the retail industry, it might be about having lots of signage around treating our workers with respect. It might be, how do you de-escalate? It might be, how do you go for additional support if you are exposed to these hazards? And all the organisations are learning, what do we need to do across the organisation? Then what might we need to do for particular groups? How are we going to report on that? How are we going to show consultation? Which isn't just a ticker box for our due diligence, it's good psychology. If you consult with the workers, they'll help you with identifying the factors, assigning risk, designing practical, reasonable controls, which they are required to be, and then letting you know if they're working over time.
Sorry, just a couple of things to throw in. The things that I've found to be quite challenging are the hybrid workforce, particularly in environments where there's potentially the fundamentals of work are managing conflict, or it's a remote working environment, call centres, things like that. The hybrid model and what that looks like and what is healthy and what works and delivers the best outcome for the psychological safety of the workforce is not necessarily the intuitive of what you'd think. The flexibility is wonderful. I can drop the kids off, I can pick the kids up, all of that, which of course it is. But finding that good balance between, but I still feel like a part of a team. We had a team member start not long ago, and she said to me 3 days ago, I don't know what the culture is here. I haven't met most of the people who work here. That is an issue for me as a leader and for me as a business owner. So that's I found that that's quite challenging. And the other thing to echo Tessa's words is the importance of leadership cannot be underestimated, and the quality of leadership is just so important. People will follow a good leader. Look through history. There's instances where there were all sorts of leaders, but they were good leaders in how they led, and so people followed. But if we promote people who are good at their job and don't then provide them with the skills of being good leaders, that's not a direct correlation. So that becomes difficult with difficult conversations. How do I know clarity of my job? What is my success? How do I demonstrate that I'm being successful? That does require good leadership. And so there's a whole piece of work around good leadership.
Absolutely. It sounds that we need to dip into our creativity, dip into innovation, dip into really bringing everybody on this journey with us, rather than seeing it's in the too hard basket. We can really look at this in a way that's quite creative. So, Ross, I'd really like to talk to a little bit more about these controls and thinking about if an organisation was moving towards certification or really wanted to be best in class, how are these important in that journey?
So when implementing controls, your aim is to eliminate the hazard, and where you can't, then you implement additional controls to mitigate that. But you need to assess whether those controls are effective or not. And when you do have an incident or an accident, you need to go back and review those controls. What more can we do to improve and further mitigate those? Because if an accident or an injury does occur, it sort of suggests that your controls aren't where they need to be.
That's a great point. So it leads me into thinking about some of the organisations that drop in wellbeing programs or wellbeing initiatives and think it's the be-all, it's the tick the box exercise, and we've done that. So Lana, can you tell me a little bit about your experience around those wellbeing programs and whether they are effective?
Yeah, and look, some wellbeing programs are great, and I've seen some really well-executed wellness programs. I think the key here, and for years, I was talking to Tessa before about how she got into this, and it wasn't even that long ago that we even started talking about this in the first place. But I remember wellness programs when I was an OT out of uni at a hospital I worked at. So I've always been interested to understand what are the key indicators? How do we know this program is successful? It's targeting the things that are helpful for our organisation, our workforce. So all of a sudden, well, not all of a sudden, but now finally we've got a means of understanding what are the hazards of our environment, what kinds of drivers there are for hazards, and then what controls can we implement to address those hazards. So wellness programs can actually and should have very clear KPIs and success measures. And like I said before, one of our clients, hybrid work environment, the whole kit and caboodle, but their wellness program is structured in a way to address the hazards that we've identified and to support people. Because I find that psychological safety hazard management is so much more broad than plant or traffic management or whatnot. Firstly, there's so many more factors to consider in order to get it right. And secondly, you can't see it. So unless someone tells you that this is good or this is bad, or, could be better, it's very hard to know if you're succeeding. So what are the programs for measuring and monitoring the effectiveness of the wellness programs? And that kind of takes us back to the systems of continuous improvement where, if we decide to risk assess by survey, well then when are we going to do the next one? How do we know that it's a successful outcome? And how do we get the data that is meaningful? And how do we, safety professionals, use that data to then improve the program or alter the program, etc.
So what you're saying is that an organisation that has a yoga session at lunchtime and some fruit bowls in the kitchen is really not cutting it?
Well, it might be, but it's not the whole, I would want to understand why fruit's important. I mean, it might be, no doubt about it, but why are we doing that versus training and conflict resolution, or an incredible OVA program for people who are on the front line who are dealing with, one of my clients in the room has an amazing OVA training program, but it's, it needs to be targeted to the set of the hazards or risks that we're dealing with.
Yeah. And I think that's the key point, isn't it? It's not about, psychological health and safety is super important. It's about, and then just dropping in a program, it's about looking at what are the hazards and assessing those risks. We've got a question.
Lana, I love what you're talking about. I'd like to put it to you for your thoughts that wellness programs absolutely have a role. They have a really important role in creating a perception of care, whereas psychosocial risk management actually creates that culture of care.
Yeah.
I'd be interested in your thoughts on
Yeah,
that.
that's absolutely right. And I think, again, it's about that perception, right? So if I work in a working environment where there is a wellness program, my immediate thought is someone cares about my well-being, right? So the perception is there. Whether what I need out of that wellness program can be vastly different things. And to complicate things further or to make it more challenging, different individuals, because we come from different backgrounds with different potentially trauma, grief, whatever it is that makes us a human being, we will all have slightly different needs. So therefore, that data that drives, and I'd love your thoughts on this too, but that data that drives the definition of what's hazardous in our working environment should be gathered from people who work in this environment, not the OHS committee sat down and ticked some boxes on a risk assessment and assumed that that's what's happening. The validation of that data is absolutely integral. And yeah, so I absolutely support those programs. I've had a client, a senior management team member once say to me, I don't want to ask those questions in the survey. I don't want to hear the answers. I'm too scared. What are we going to do if the answers are these? It took me about 5 minutes to collect myself. But eventually, you know, it's like any other hazard. In a physical hazard environment, the more I know, the more I can fix. So it's not about, oh my God, I'm an awful leader. Although in that instance, that person may have been afraid to hear those words, and that would have been, they themselves would have needed a support around that. But it's often the case that a psychological safety program is going to tell us that we're awful, and a wellness safety program is really lovely. You know, they're actually one and the same. It's the same coin, just different sides.
Thank you.
Tessa?
Oh, I wanted to add that there's still a lot of good evidence for mindfulness and for some online programs and things like that. But absolutely what you said, what works for one individual with their mental health might not work for another. And what works for one of them at one point in time might not continue working. Also with those programs, and I think resilience is a good thing, but I think it got used in a particular way. So I haven't seen those programs benefit when people are exposed to ongoing bullying and harassment. I haven't seen it be able to prevent and manage that, or ongoing excessive demands. In fact, people felt that they were being told, can you go do the resilience program so that you can manage the excessive workload? And, oh, you're doing better? Great, we might give you more work. So while I do see that benefit, I see it most occur in the right environment. So I don't necessarily see those programs addressing those psychosocial factors. I do think we need both.
Absolutely, but what the example that you provided there in that resilience training for the worker that's got the high workload, there would be that animosity towards their leader, not wanting to get up on a Sunday, and expecting that to help.
And we saw the resentment towards resilience, which again, it's a beautiful human thing. It's how it got used within those workplaces. Yeah.
Yeah, you've kind of begun to address it because I wrote it down earlier. But are there any practical measures that can address concerns about reasonable managerial direction and the varying understandings of the hazards such as organisational change management or low job control or any of those kind of ones? It's not as easily defined as occupational violence or bullying and fatigue, but it's very much potentially they've been in the business for 40 years. They're in a low job control position, and now we're kind of potentially giving reasonable managerial direction, but it may be coming across as,
And it is the workers' perceptions that will predict your outcomes. I would suggest you need to get shared perceptions across leadership, workforce health and safety, HR, on how we manage those factors. And this is where the interaction effects come into it. So for some of those obvious hazards, the client or customer aggression, you might have some more obvious policy, practice, procedure. But job demands, if I could have found a line to say to you, here is the safe level of job demands, I would have done that 10 years ago. I did try. What we found was it depends on the individual and the context and so much the leader. So different individuals have different capabilities, and that might change throughout their career. It might change throughout their week, depending on other factors. Same with job control. Some people prefer more structure. Somebody struggling with their mental health may benefit temporarily from more structure. So there's an element of job demands, the types of job control, the types of reward and recognition. And then the key I found, if somebody's struggling with their job demands, can't find the right resources and supports level of job control to help them with those demands, that suits them, that suits the team, that suits the project, has to be reasonable, has to be practical, then if they've got a leader that they can go to help them manage those interaction effects. So it does come down to, I've just seen it in the data, good supervisor predicts all my outcomes because they can support those interactions. And if I don't have senior priority above the good supervisor, my controls are less likely to generate positive outcomes regardless of what the controls are.
You did touch before about leadership and leadership capability and how important that is in this space of psychological health and safety. I wondered if there's any sort of frameworks around leadership, because I know leadership and getting that consistency around good leadership is quite difficult. Is there a framework around good leadership that we could use? And I might start with Ross. Yeah.
So from the standards point of view, there's a list of responsibilities that are key to having an effective management system. So overall, the senior leaders are responsible for preventing illness at work and promoting well-being. A good management system, basically what's important to my boss is important to me. You take that sort of philosophy. And leadership under the ISO 45003, you need to protect people, to encourage them to speak up. You need to develop the strategy for the organisation, allocate the responsibilities, and set up a framework. And that's good.
Over the years, I've found, I've been consulting for 20 years, I've been in lots of different businesses. I found the clearer the communication from leader to their team, the better the outcomes, both production-wise or operation-wise and health-wise. And so we run this psychological safety program in quite a structured way. So we start with interviews. So I want to talk to middle managers. And so one of the questions is, how do you know you're being successful? And how do you know your team is being successful? And you would be surprised how many people take a breath and stop and think before they tell me what success looks like for their organisation as a team. So if we're on a bus, where is this bus going? Also, what is my team? How am I as a person contributing to that? And what is my team doing to contribute to that? And all sorts of discussions fall out of that. It's absolutely eye-opening.
Got to say, it's backed up in the data, the greatest shared consensus we can get between all the levels in an organisation about what the factors are, what's the priorities, what do we currently have in place, what could we be doing, the more we will likely to see risk reduce over time. The seniors, there is an expectation or requirement that they're aware that they can't play ignorant. There's too much regulations, guidance out there. There's a merit, they can't play that. So they need to be aware and they need to demonstrate their priority through the policy. HR and workforce health and safety need to understand their role and to invest in those middle leaders. They transmit that policy, that procedure into the practice. So understanding, again, what is their responsibility and what isn't, and where they can go to for support, because we're finding they're quite burnt out. And I come across many well-intentioned leaders. Sometimes they actually take on more responsibility than required. For me, with the leaders, I go for emotional intelligence. Through my recruitment and promotion, the technical skills, generally you can see that on the CV, and much of it can be taught. I find it much harder to teach emotional intelligence. I saw a lot of leadership programs and frameworks work for those who already had emotional intelligence. They got better, it gave them confidence, it was more enhanced. But for those who didn't, we wouldn't see that change. So I would definitely be looking for that.
I want to play devil's advocate now, right? And this is why I came today. So same as you, I have a PhD in genetic engineering, forensic science, psychology. I spent 35 years in the military. I'm now retired. I'm a civilian for 5 years. I work for a company, a national company where we work in risk every single day. I have nearly 10,000 staff, frontline security personnel across the country, as well as cleaning and facilities maintenance. So we deal with violence, we deal with aggressive people every single day. Even as much as yesterday, we had a staff member had a gun pulled on them, and we're going through a process. Now, I want to put a question to you. Just in Victoria alone, last year, $246 million was paid out in workers' compensation through Victoria for mental health workers' compensation payments. Yep. Through that, we've now found out statistically that over 73% after being analysed after payments have been paid out to members of staff have been false claims. Yep. People have been long-term workers' compensation, long people going to doctors to get COCs, not engaging in IMEs, and you've got companies that pay millions of dollars in workers' compensation, which we do as we're a part of that, and that's why we're pushing things like self-assurance, because you're not getting that value-added support from our insurers to say, and medical practitioners, and it goes on. You could have someone, coming forward and say, yep, I was verbally aggressively managed yesterday, and spend the next 10 months waiting for an IME, medical assessment. Now, we have great programs. We have our EAP, we have great leadership, we do Working Safely Wednesdays every week, we do video talks, we do conferencing, we have leadership downwards where we're face-to-face engagement, we do de-escalation training, we do conflict resolution training, we have an RTO in every state. Yet, I'm still governed and managed on how many people I have on workers' comp through mental health or how many people I have through injury. Yep. So when I go to the next business model and I say, hey, I'd like your opportunity to come work with you, one of the first questions we get asked is, because we're ISO accredited through SAI Global as well, so we've got all the ticks in the box, I call it the cosmetic ticks in the box. Yep. I'm not saying I'm a good looking guy, I'm about a 5, but I'll go with the 5, right? But we have all the cosmetic stuff, yeah? So when we go, we do the tendering, we look fantastic on paper. I think that's what you said earlier on, yeah? How do we then go and say, we have 35, for example, workers' comp claims, and out of those 35, 32 are mental health. I've got long-term strategies where people are at 50 weeks and 42 weeks because we can't get appointments and we can't get this done and we can't get a psychological evaluation. But this person sits at home playing the play box, my son would kill me for saying that. I don't know what you call it, but the play machine or whatever they do. PlayStation, the play machine. See how old I am, like 52 this year, crazy. Now, we do everything we can to engage, to return to work, and you do the engagement in regards to having conversations, and we bring them out, and we want to build that culture and atmosphere where they're safe to come back to work. But yet all these systems sound fantastic, but it comes down to that individual, whether they want to come back to work, or whether they want to participate, or whether they actively have ticked that box with a doctor and said, no, I'm mentally not ready to come back to work. And then that process just goes from week to week to week to week. Now, I'll tell you, the statistic was given last Thursday by the Supreme Court of Victoria that $740 million was paid in legal fees last year for businesses defending mental health claims in Victoria. Right? So just those two payouts alone is $100 million paid out of Victorian businesses under mental health support to get people to come to work, and that doesn't include the $891 million that's estimated paid this financial year in mental health payouts, right? So where does a business like ours, or businesses in this room, we've got to come up with that money. Now, and I said I'm playing devil's advocate here, right? Devil's advocate for me, and I'm all about mental health. I will tell you now, as a soldier, I buried 8 of my friends in 25 years, okay? And 3 of those through suicide just in the last 4 years, coming out of service. So I'm a massive champion for mental health. I've been an ambassador for mental health most of my life. But I've also got to look at it as a business and say, when I go back to our board and say, I've got a payout next month of $46,000 because John Smith has said for the last 52 weeks, I don't want to participate. I don't want to return to work. All the systems in place are there for them to return to work. All the systems are in their place to support that person to return to work. All that compliance is in place, and that's my job as National Health and Safety Risk and Compliance Manager within my business. That's all I do every day. Is I've got to make sure legally I'm ticking that box, then I've got to make sure mentally I'm ticking that box, and then I've got to make sure the programs are in place that when I do get challenged, and we do get challenged, especially when you're a tier one like we are, and we get people like our clients come back and say, what have you done to do this? But I've still got to put my hand up and say, I've got 35 people not happy to come back to work. And it's costing our business the programs, the payments, the weekly workers' comp payments, the excesses, the insurances, and all the wellness in the world to get these people back to work. So my question to you as being devil's advocate is, I think the structure is great, but we've got to come back to how do we get that person in that mindset who has had that issue to say, hey, we're here to help you, right? We've got the systems, but you're not participating.
Can I ask a question?
Yep.
Are you national?
Yes.
Is it different statistics in Victoria than the rest of Australia?
Depends on the events. So I'll give you an example. Like if we go to Northern Territory, for example, we have a high violence rate through to a culture up in the Northern Territory, where some of the bottle shops we look after have restrictions in regards to trade and due to violence. But if you look at people like, if you look at like South Australia, we hardly hear anything.
I mean, arguably, sometimes when you don't hear something, it's not always good.
Oh,
I'm from South Australia, and they're a little bit behind in the regulations, but I don't hope.
But if I'm looking at my numbers, but I suppose my question to you is, how do you engage those people? And because it's got to come from a cultural mindset of the individual, not from the company as well.
I also think, sorry to interrupt, having been in workers' comp for a very long time. And be interesting to see, Natasha, if you've got any thoughts on this. Natasha's our workers' comp consultant. The frameworks of our systems do not set us up for success with this, right? So the workers' comp system in itself, the workers' compensation system, does not enable the employer to do anything other than pay their premium, pay their liabilities, right? So if there's any way of becoming self-insured, I would strongly recommend that you do that. Yes, you still have to comply with legislative requirements of claims management, but all of a sudden you can implement amazing programs of return to work, of support, of provision of service. You can fund it yourselves, you can run the stats and data by yourselves, you can find a way that works for you. So that's one thing. The other thing, and it'd be interesting to see what your thoughts on that are, the selection of people to work in these roles where all you, in the security environment, you deal with conflict potentially all day, every day. If I've had trauma in the past, I'm probably not the best worker in that space. But I'm probably also an immigrant. I probably don't speak English very well. It's a good job, pays good money. I'll go and get that job. Do I have the inner ability to deal with things in this job? I don't know. And I won't know until someone pulls a gun on me. So the pre-selection and the criteria of determining what is the right set of people to employ in certain roles, to me makes a lot of sense, and I've seen it done really well.
We're going to look at the demographic of, and especially in our industry, because we're a licensed industry, the individuals are licensed.
Yes.
So it's not like I can put it out on seeking
correct.
It's a truck driver. Right?
Yeah.
I've got to go through legislative requirements, I'm going to interview them, and you are right, because we draw from a very small pool. But and you talk about here's the what interests me to comment early on. So I've just finished doing a risk management survey through our workers' comp, and we looked at all of the places that we have paramount workers' comp and what it's costing. So actually, self-insurance, we were ahead of where it's going to do all of them at the moment. Everybody told. It's because we need to manage the individual better. That's the reason why we're driven. That's why we're driving workers' comp. We're not driving workers' comp to save money. It's a safe. Don't get it wrong. Yeah, it's up. It is. But the devil advocate for us is when I go to Allianz, for example, in Victoria, and say, hey, I've got to go over to a person to workers' comp. I'm going to send them to a leader, which we have a national deal with self-health. We do all the ticks in the boxes to get that person assessed 4 months later. But if I'm driving it myself, then I can help.
Yeah. The system does not set you up for success.
I don't want to be here criticising the system because I think Australia, you do, yeah, you're right. We need to acknowledge it to improve it. Because Australia, I'm so impressed that we have these systems in place. I have seen how they can influence the individual. So I see different policies. I see changes in legislation, literally direct outcomes. I won't comment on each state, but what I have seen within one organisation, a particular policy for sick leave drove totally different outcomes for one group versus a different group. So I can see how the policies can do that. I also know how important prevention is, because once an individual enters that system, it almost has a psychological impact. I almost see it have a vicarious impact on the team, on the group. Victoria did make certain moves and certain changes over recent years, and we have seen different outcomes for that particular state from our national employers compared to other states. So I won't claim to be the expert, but I absolutely know it has an influence. Once it happens as well, to create change to that culture will be incremental and take time. But it is worth all those steps that you're moving towards, because I've seen within the other states and the other groups that creating that climate with the senior priority, being clear with the individual about the expectations on them, engaging them in that process, requiring they participate because they're part of it, their co-workers are part of it. I like to work with teams so they understand their role, their responsibility, and to help them to be motivated to participate and engage, shifting them towards that, because yes, I have seen particularly concerning outcomes, especially in Victoria.
Hi there. I agree, very complicated situation. The system's certainly not set up to help the employer. My question is twofold, and it might be more for yourself, if that's okay. When ISO 45001 first came out in 2018, just as context, I spent 15 years with LRQA I was the senior OHS auditor for the country, and we had enormous problems trying to work out safety culture. It was the first standard in the world that had safety culture as an obligation, and it's in two sections of 45,001. And so our auditors were like, how on earth do we audit whether they're implementing a safety culture? So I ended up writing some presentation information that somehow got published in the end, but we were trying to find what does good culture look like and what things could our auditors look for so that they could say, yes, you're doing well on that front, or it could be improved. I ended up giving them, I think it was the 12 key things to look for an effective safety culture, because I'd seen it at some good companies, so I just plagiarised what they're already doing. There's not many original thoughts left these days. But my question is, how do you guys see the difference between culture and psychosocial risk management? Are they the same or are they different? And secondly, is there anything that you guys are doing to train your auditors so that they can chip away at this area around culture and the like? Because it was something we really wrestled with, and I don't know if we nailed it or not, but this is back in 2018 before the psychosocial regulations came out. So just keen to hear your thoughts.
Very good question. So there is a lot of overlap in between culture and the psychosocial. ISO 45003. Probably we should do more training than what we've originally done, which when the standard came out, the 45,003, we did quite a bit of training initially, but it hasn't really taken off too much. In the areas it's more dependent on the organisation to evaluate what's important and understand, what the employees are saying, where they're getting their injuries, and where they got their problems and complaints coming from, and adapting that into their workforce. And that the biggest change in the standard is not only do you have to consult with your employees, we need to see participation. So developing that culture, that safety culture. Like, we don't just tell you what you have to do. Tell us what you think. Tell us how you're going to be involved in developing this process. How you're going to do it safely. So, and that's quite a big thing in the standard, and it's also needed in the policy as well.
Yeah. Can I ask you a question with your experience? When I was looking at data across industry, occupation, actually across the world, we would see culture as an outcome of factors within the organisation. Okay, good, because that way we learnt we could actually drive culture. So if you've got good proactive psychosocial safety climates, you can actually drive and shift those outcomes over time. So things around senior priority, management trust, worker participation and worker confidence in the systems. And so, yeah, I'm glad you're nodding, because I'm like, was the data right? Were we measuring the right things? And just to take the moment to mention, on the Opus website, we've got an audit for ISO 45003. Just a number of our clients wanted to know if they're up to standard, which, by the way, that's a very high standard. And I don't think every organisation needs to apply every aspect. Those going for certification might need to demonstrate, but that would be a large global organisation, well-resourced, which I would expect to be able to demonstrate those systems. But for a lot of my clients, they're just interested in seeing how they would line up. So we've made that available for free. You can go online, do a bit of an audit, just your own, of your organisation. I will warn you now, many of our clients don't score particularly well because they don't have all those systems in place. What it does do within each question is it gives you an example of what maybe you could. And then I would encourage you to think, is that a reasonable, practical thing that I could implement and have in that space? But certainly we've got one for leaders as well, because as we've discovered, that is quite key. So for the organisation, for the leaders to know, do they line up against ISO 45003? If you have a look and you've got any comments or feedback, please let me know.
No, not right now anyway, but I think it's just a very complicated area. We would see, I was hoping to start seeing some findings around the culture's not good, we need to fix it. I never saw one. I would see auditors, though, obviously raise findings against the leadership section of 45001, which I've always thought really does align nicely with your due diligence, and it would go a long way to help developing a good culture if all of those, I think there's about a dozen points under 5.1 for leadership. So, I think it's just a challenge that because I always feel like the auditors can help push these things along. I guess companies are just desperate for knowledge, I find, at the moment. And
another interesting point, and we do that a lot, is the maturity model concept. So whether you're complying with 45003 or not, you may actually have, and as you said before, some people in this room have started and some people have quite a well-established program. Are there any, this is a question to you, Tessa, are there any models that you can recommend that are maturity models in this space that people can use, organisations can use?
I think that there would be maturity models out there, but I just find every organisation's different. I always have my clients come to me saying, I want to compare to others like within my industry or even other industries, and we have a look at those and we go, oh, okay, that's where you're at. But as far as the regulator, they just want to know where you're going, what you're doing. And I do find more mature in all of my conversations over the last few years, more maturity with, there's that awareness and just people using this term. Psychosocial makes me very happy. It used to take a long time to get through just that in my initial conversations. So, but whether it's awareness and training, and then it's, do you actually have systems that are implemented? Also, are those systems based on the evidence with the risk assessment? Because just like with physical, you would want a risk assessment to know where the priorities are, and you don't need to assess for every potential physical hazard. You need to identify the ones that are likely to occur within your groups, find where the risks are, design your controls against that. So I find we're getting closer to the awareness, a bit of the risk assessment, very, very happy to see that best practice happening now. But then designing the controls is probably where I see a difference in many of my client groups. Some have it clear for really obvious hazards, others are struggling with those interaction effects. And then the evaluation. Let's evaluate, let's see if what we're doing is working, because that's workforce health and safety, ongoing continuous improvement, acknowledging, being not trying to remain ignorant of where you're at, acknowledging where you're at, putting controls, reasonable, practicable controls into place, and then evaluate and see if they work.
Just with the standards, 45,001 is a certifiable standard. 45,003, that's a guideline standard, so we don't certify to that standard, but we can do audits against the standard to see where the organisation's at.
We have a question.
My turn. I'm coming from it from two ways. So I'm a QHSE and IS compliance manager, And my company do all the right things that you're talking about, but my wife works in a call centre for a local council, and they're on the front line of abuse day in, day out. She sees colleagues in tears once or twice a week, and I'm trying to understand how the people that are on the front line can push their management to do it, because they're not getting any of this leadership or as part of the buy-in, the looking at the objectives and targets, identifying risks, putting mitigations in place. We're not seeing any of that.
Can I be bold and throw to a participant within the audience? Fiona, would you mind sharing your expertise that I know you have in this area? I did. Sorry, I know. We work together with a call centre group, and I know what happened. And I'll remind you if you've forgotten anything, because it was a little while ago.
Yeah. Thank you, Tessa. So Tessa and I work together. I've come to my current role from Australia Post, where I was head of mental health for some 6 years, and the contact centres at Australia Post, about 1,600 people over Australia. And as you can imagine, people don't ring Australia Post to say, great job, delivered my parcel, good on you. And so I absolutely understand what you're talking about. Customers who are verbally abusive, who are racist, sexist, who threaten to harm themselves because the parcel hasn't been arrived, threaten to track down our contact centre people. So all sorts of things. Huge body of work, took a lot of people cross-functional across the organisation as well as external expertise to put in place a system to really look at controls that targeted leaders, our customer service people, prevented or tried to mitigate the impact of our customers. So we took a multi-pronged approach to do that, more than I can talk about right here, but also in roles that were very KPI driven, very metric driven, very low job control. I think a lady here asked about that. We absolutely looked at progression through the contact centre, so opportunities for career progression. How do we make sure people are well connected to each other and their leaders? Talking about a hybrid working environment, so a lot of work in that, because our contact centre people largely work from home. So how do we make sure they feel connected to the organisation, purpose,
within
safe?
the four walls of their living room?
Absolutely.
I've just done this project as well. So.
Yep. So a lot going on there. When I hear about contact centres, it's so dear to my heart. I'd love to talk with your wife.
My recommendation is to report, because they will have a safety management system somewhere in the thick of it all, and it's driven by data. So the more incident reports there are, someone eventually will say, there's got to be something going on over there, we've got to go and fix it. We just ran a workshop, we've got a local council as a client, and we ran risk workshops for every single one of their divisions, including that area. And you'd be surprised how many people do not report. This happened. Did you report it? Oh, I didn't think it was anything to report.
They don't want to report every single little micro one. It's very difficult. We've gone through the reporting, and for the obvious ones, it's such a necessary process. It also gets them the debrief. But for the micro ones, they didn't want to have to report. They actually felt that caused them more trauma. So what we saw was the leaders.
Sorry. That does seem to be you've got all the information available, and the reporting drops down to the person that's on the front line, and you've got a chance to forward that up. My wife's been asking for 2 years for a message on the initial call.
That is such an important. That's like
and
a
it's
first.
really basic.
That is, isn't it? Like that messaging.
Filtering up.
Leaders need to get a shared consensus on what they're doing to manage that. That's such a reasonable thing to ask. Possibly through the data. Keep reporting.
Report.
There's a lot of evidence, and if you need business case evidence, we'll support. There's so much potential productivity improvement, so much potential prevention, sickness absence, presenteeism, individual level, team level, cohesion, interpersonal issues. It will predict bullying and harassment reports, things like that. You need to get shared consensus between the leaders on that being a priority, how you're currently managing it, and some practical strategies like a pre-recorded message.
That's where you're struggling. I do have another question here before we close.
I was at a HR networking group last week, and the question was raised, we were talking about this exact topic, and the question was raised as who kind of leads it within the organisation? Is it safety or is it HR, people and culture? And then we did sort of show your hands, and everyone went, who thinks it's HR? And half people put their hand up. Who thinks it's safety? The other. And then as we talked about it, we actually said it's actually both hands. And it's kind of that Venn diagram of the perfect overlap between.
I'll throw it back to you, Steve.
Yeah.
Who's responsible for health and safety within an organisation? Who has duties under the Act?
Well, the
top
leaders,
management.
the leadership.
We are discipline specialists who can help organisations improve both HR, safety, but unless whoever's the CEO, the CFO, the owner, if they're not committed to this, we can create the most beautiful systems in the world and they will never see the light of day and never deliver any outcomes.
Okay.
We could keep going, but just like that, time has passed. But we're here for another half an hour, so please join me in thanking Tessa, Ross and Lana for their wonderful insights and expertise. And we also like to thank Blue Rock for this amazing space here today, and all the cast and crew who have helped us facilitate this session, and for you for coming along and being so interested and passionate about this particular topic and trying to make a change in your particular workspaces to make them the places that we want to come to on a Monday morning, and we want to be our best selves and thinking about your next step. So please join us for refreshments and continue the conversation. If you've got something that you'd like to ask or dig a little bit deeper into, the panellists would love to hear from you. Refreshments down at the back. Thank you.